Hello and welcome to the Texas Tribune TribCast for March 18th, 2025. I am Matthew Watkins, editor-in-chief for the Texas Tribune. We are recording early this week. It's the Friday before as the Watkins family prepares for our trek to Legoland in California. And this week, of course, as always, joined by our co-host, Eleanor Klibanoff. Hello, Eleanor.
Hello. Excited for you to go to Legoland.
I'm very excited.
Sorry, I'm missing it.
My son could not be more thrilled. And my wife also told me last night that she said that you are the better host of the TribCast and that you do better banter than I do. So I just want to just open the floor for you for any banter you would like to provide.
So high stakes now. I will say every time I end up at a social event with your wife, it is just me and her talking in the corner. So I think she just likes me.
That could be.
Right. I'm not sure she speaks for the audience.
Or doesn't like me either one.
Or doesn't like you. But yeah, you know, I'm honestly, Legoland sounds pretty great. I've never been. Is your daughter excited about that?
It is she's excited for my son, who is younger and obsessed with Legos. She was also they were both very intrigued by the Legoland Hotel, which apparently outside each elevator has a whoopee cushion. So they've been talking about this for weeks.
Okay.
And maybe I will report back in future eepisodes.
Someone tells me there's going to be like a big setup where they like are tricking you into where you are well aware you're being tricked into using a whoopee cushion.
Yes.
Yes,
indeed.
Well, that'll be great. We here, meanwhile, we're recording this on Friday. It is the bill filing deadline. So we're in the weeds, but we're so glad you're getting some time off.
Yes.
Oh, that's great.
It's good to be the editor-in-chief.
Yeah, exactly. I'm sure.
All right. And this week we are joined by a special guest as well, Dr. Peter Hotez, who's Dean of the National School of Tropical Medicine at the Baylor College of Medicine and author of the recently published book, The Deadly Rise of Anti-Science. Dr. Hotez, thank you so much for joining us.
Oh, thanks so much for having me. I'm wondering if you could have your kids, when they're Legoland, make me a funded grant from the National Institutes of Health out of Legos.
Absolutely.
That may be the only ones left. So see if you can work on that.
I will see what I can do. Right.
Worst case scenario, we'll give you a whoopee cushion. I think that's what we can offer.
Do medical schools get spring break?
You know, that's the problem with the medical schools and academic health centers versus, the typical, 4-year colleges, because every day, it's all based on sponsored research and grants and seeing patients. And so the summers don't mean as much and that sort of thing.
All right. Well, we will do our Lego work for you and on your behalf in California. The reason we have Dr. Hotez on this edition of the podcast is because it is March. Therefore, it is the 5th anniversary of the sort of ramping up of the COVID pandemic in Texas. It was the end of March where Texas really started to impose the restrictions. It was the early part of March where the first sort of cases started popping up. It has been a challenging 5 years for many of us, Dr. Hotez in particular, in the aftermath of that. And of course, now, 5 years later, we are dealing with another public health crisis, at least maybe not on the scale of COVID 5 years ago, but still a scale that is very concerning. This is, of course, measles and the large number of cases of measles. As of Friday, as of today, the day we're recording this, Texas has had more than 250 measles cases and 34 hospitalizations, 1 death. Eleanor, you and the health team have been involved in covering this. Let's just start this conversation by telling us a little bit about what's been happening with these cases in recent weeks and months, where we sort of stand in this crisis right now.
Sure. So this outbreak started in West Texas in Gaines County, which is a small rural county in West Texas, sort of southwest of Lubbock, along the New Mexico border. And it started in a Mennonite community, which is actually pretty common for measles outbreaks to start in, more tight-knit, closed-off communities. In this case, the Mennonite community has very low vaccination rates. And it just spread from there. As I'm sure we're going to get into, Texas has seen declining vaccination rates for measles in recent years, which just means there's a lot more people who are sort of susceptible to getting measles and spreading really fast based on the experts we're talking to. We've not really been able to put a lid on this, as I think many people had hoped in those early days.
Doctor, you are one of those experts. I mean, what are you watching when you see these cases and what's happening out there in West Texas?
Well, I think the numbers are probably lowball estimates, from talking to some of the public health officials on the ground and colleagues. I'm getting a sense that the numbers are far higher than 250 because some are not seeking medical attention and others, trying to do remedies at home and that sort of thing. So the real number could be several hundred. And of course, the one thing you cannot hide are hospitalizations. So 34 hospitalizations. That's pretty rough, especially since probably most of those are kids, and most of those are probably hitting one children's hospital in the region. So the outbreak is centered on Gaines County on near the New Mexico border, as you point out, but the Children's Hospital is about 100 miles away in Lubbock. It's connected with Texas Tech. So they're getting hit pretty hard, I would imagine. Those kids are sick. I mean, measles is a bad actor, roughly, a high percentage of hospitalizations. The reason they're hospitalized is because of measles pneumonia. Causes the virus when it causes the rash, because the virus gets into the blood and goes to the skin, it also goes to the lung and causes this very severe, it's called giant cell pneumonia because of a particular type of cell that appears in the lung. And they require respiratory assistance, sometimes even an ICU admission and intubation. Of course, the one death and encephalitis, permanent neurologic injury, deafness from measles, otitis, and ear infection, and dehydration from diarrheal disease. We forget that at one time measles was the single leading killer of children globally, and now it's hitting Texas really hard. So this is a humanitarian tragedy of sorts because none of this had to happen. These are almost all among unvaccinated kids and adults that could have been prevented with an MMR vaccine, measles, mumps, rubella vaccine. It's one of the best vaccines we have. I make vaccines for a living. Our laboratory at the Texas Children's Hospital Center for Vaccine Development in Baylor, we develop new vaccines for virus infections, for parasitic disease vaccines. When we design a vaccine, our gold standard is the MMR vaccine because you can't do better. Our that's our dream, that's our aspiration to make something as good as the MMR vaccine. We never quite get there, but that's the aspiration. But just to give you a sense, that's how good the MMR vaccine is, and the fact that it's been withheld from these kids because parents have been victimized by this disinformation wave is just so demoralizing and sad. And so it's a lot of sadness all around. And then the last point, before I'll let you get a word in edgewise, is it's still going. This evergreens every 2 weeks. The reason I say that is each time the number goes higher, remember the incubation period from the time you're infected with the virus till you show the symptoms, the rash, and the three C's, the coryza, conjunctivitis, and cough. It takes about 12 to 13 days. So we know at least this epidemic will last to the end of the month. And I think at this point it's going to go well into the spring. So we're in for the long haul in this one, unfortunately.
Right, and one of the things they say about measles, right, is when you are not vaccinated is just kind of unbelievably, uh,
So
it's
contagious. Yes,
contagious.
so
Yeah,
contagious. Yeah. It's like I think it's like if you are unvaccinated and you're in the room 2 hours after someone with measles has been there, you have a 90% chance of getting it. It's like,
Yeah. There's two factors in that. One, the inoculum required for you to become infected, that is the number of virus particles, is very small. And as you just pointed out, the virus can linger in the atmosphere. So you don't even have to be in direct contact with someone with measles. Someone could have been there, coughed, sneezed, spread virus particles in the atmosphere, it aerosolizes. You can go in 2 hours later and then contract the virus. And that's why the measles virus has one of the highest, what we call reproductive numbers that we know about in infectious diseases. A reproductive number means the number of people you'll infect if those individuals are not vaccinated. So in the case of measles, it's 12 to 18. which is even far higher than coronavirus, which itself has a very high reproductive number, especially the Omicron. But this is the mother of all reproductive numbers coming from the measles virus.
Doctor, I hear your frustration, right? It's such an effective vaccine when people who are not vaccinated catch the illness and get sick. It feels like something that was preventable, should have been prevented, and things like that. I wonder if you could help me try to understand as I kind of grapple with the context of this. Is, of course, and we're going to talk more about this, we are coming off of a pandemic, right, where vaccine skepticism hit kind of all high new levels, where public officials have, in some ways, encouraged that skepticism. We're also talking about an outbreak within a kind of, contained religious community that has perhaps been traditionally, dating back even before COVID, somewhat suspicious of modern science and things like that. I'm wondering what sense do you have of how different this individual case is because of what's happened, during and post kind of the worst part of COVID, or how much of this is just a type of outbreak that we see sometimes from very particular communities that might not be as vaccinated as the population as a whole.
Yeah, so a lot to unpack there. So let me start unpacking. The First of all, I'm told I don't have a deep knowledge of the Mennonite community. I'm told they really do not have prohibitions against vaccination, that in general, but that some anti-vaccine activists somehow got to them and convinced them of this. So park that thought for a minute, but let's go back about 10 years. So the point is the anti-vaccine movement in Texas, which is probably the most active of any state in the country and maybe the world, started about a decade ago. And in fact, it was a decade ago I wrote an article in the Public Library of Science, more or less predicting this. It was called Texas and its Measles Epidemic. And the reason was, if you remember 20 years ago or 25 years ago, the original assertion against vaccines was false claims that vaccines cause autism. And that started with the measles, mumps, rubella vaccine, and then pivoted to thimerosal and a lot of other things. And that's how I got involved with this, fighting the anti-vaccine movement, because I'm a vaccine scientist developing low-cost vaccines for global health. But then I'm also the parent of 4 adult kids, including Rachel, who has autism and intellectual disabilities. And I wound up writing a book called Vaccines Did Not Cause Rachel's Autism, about my daughter, which wound up making me public enemy number 1 or 2 with anti-vaccine groups. But it also gave me a front row seat to seeing what this thing was all about. And what I saw about 10 years ago was kind of a shift or a pivot in the nature of the anti-vaccine movement, from the main focus around of fears that vaccines cause autism, which had actually started to dissipate a bit until our good friend Robert F. Kennedy Jr. just became Health and Human Services Secretary. Now he's resurrecting it. But it was actually going down in favor of a different aspect to the anti-vaccine movement, where it became more political in nature, around this banner of health freedom, medical freedom, where it got picked up by, and this is where it gets hard to talk about because we're not supposed to talk about politics. At least physician scientists are not supposed to talk about politics, right? We're supposed to be politically neutral. We're not. But, I haven't found a way to talk about it other than to talk about it. So I talk about it, or I write about it, not because I care about your politics, that you're right as an American citizen, you're right as a Texan, but to say, let's uncouple the anti-science stuff from it because it's so dangerous. But about 10 years ago, it got picked up by the Republican, what was then called the Republican Tea Party in Texas. And it started giving PAC money, Political Action Committee money, to anti-vaccine groups, because they were rallying around this concept, which I consider kind of a propaganda concept around health freedom, medical freedom. You can't tell us what to do with our kids. And these anti-vaccine groups were, convincing parents that vaccines were instruments of political control. You don't need to get vaccinated. They were downplaying the severity of the diseases they're designed to prevent. They were exaggerating the side effects of the vaccine, and basically working on our state legislature to, file anti-vaccine language to make it easier to exempt kids out of vaccinations. and put in a lot of onerous language around the legislation and even support candidates to run on anti-vaccine platforms. It made no sense, but I guess it made sense because this became kind of a platform of the far right. And the consequence of that was starting around 2014, 2015, you started to see this very steep rise in the number of parents requesting non-medical exemptions for their kids, to the point where we got, now over 100,000 kids in Texas not getting their full complement of vaccines. And this doesn't say anything about the homeschooled kids. We have no idea what's happening with the homeschooled kids because they're homeschooled, and probably hundreds of thousands more. And it had this unique kind of flavor to Texas, but Texas is now being the tip of the spear for the rest of the country, or at least the rest of the red states. And that took us up to the pandemic. So things were already bad for the 5 or 6 years prior to the pandemic. And then during the pandemic, COVID hit, and it even became more political and more dangerous. I wrote about this in the book, The Deadly Rise of Anti-Science. It got picked up at the CPAC Conference of Conservatives in Dallas in 2021, where, they were in there, and this is after mRNA vaccines became available for COVID. There was a big pushback around vaccine mandates, which you could kind of understand. But what they did was they went the next measure and falsely discredited the effectiveness and safety of vaccines. So the rhetoric at that CPAC conference, Matthew Cawthorn, the representative from North Carolina who was there, to paraphrase him, I don't remember the exact words, was more or less to the effect of, first they want to vaccinate you, and then they're going to take away your guns and Bibles, which is, again, this health freedom, medical freedom concept. But then they paraded out all of the most toxic anti-vaccine activists to falsely discredit the effectiveness and safety of vaccines. And that was what was so dangerous. And then the pylon came from the U.S. Congress. Congresswoman Marjorie Taylor Greene, called people like me medical brown shirts, comparing vaccines to the Holocaust, or Lauren Boebert, started calling them Fauci ouchies. And then you had Senator Ron Johnson of Wisconsin hold these phony baloney vaccine injury roundtables, and Rand Paul was piling on. And then Fox News joined in, and this was documented by two groups, Media Matters, a watchdog group, and a research group out of the Federal University in Switzerland, documented how Fox News, during that Delta wave, that started around the time of the CPAC conference, unfortunately, when vaccines were widely available, every night Tucker Carlson, Laura Ingraham, Sean Hannity were falsely discrediting the effectiveness and safety of COVID vaccines. And then there was another amplification effect with Joe Rogan podcast at that time. He was not really very anti-vaccine at all prior to this, and decided to flip to that and started pushing ivermectin, which does nothing for COVID, in lieu of vaccines. So it became this whole ecosystem. So people in our state of Texas started, going down that rabbit hole. And then I'll stop in a second. And the point is, Texas had the worst experience with COVID of any state in the country in terms of total numbers of deaths. It's tied with California with 100,000 deaths, although Texas is a considerably smaller population. But of those, half the deaths were needless deaths, because just like the measles cases now, those 50,000 unnecessary deaths were in people who refused to take a COVID vaccine because they went down that rabbit hole on Fox News and everything else and made an executive decision not to vaccinate. And that's what we're dealing with. This is, it's not some academic discussion or theoretical discussion. This anti-vaccine activism in our state of Texas is a lethal force right now.
Yeah, I think back at some of the public health crises I've covered as a journalist while living and working in Texas. The first one that comes to mind for me is I was at the Dallas Morning News covering county government when the Ebola scare happened, right? And I remember the very sort of unified and together approach that Dallas County Judge Clay Jenkins, a Democrat, and the governor at the time, Rick Perry, took in terms of fighting this illness. I mean, I think if I remember correctly,
yeah, he was terrific. Governor Perry invited me to serve on his infectious disease task force at that time.
There you go.
And it was all hands on deck, and Governor Perry was all into universities and proud of that, and
Yep.
Very
so it
unified.
was
Yeah.
Yeah.
so the point is it was normal. It wasn't
Right.
crazy.
Right.
And
Right.
right.
And then you have COVID, right? And in the early days, you have Governor Abbott, giving regular press conferences, shutting down businesses and in schools and everything like that. He then, as
And I
political.
was on his task force then, and it was normal.
There you
It was
go.
the normal response. It was all
Everybody's
good.
best
We were
friends.
Exactly. Yeah.
Right.
That though he loosened a lot of those restrictions later on, of course, and then but when the vaccine came, I remember him giving a press conference, receiving the vaccine,
Got the shot. Yeah.
on television cameras, everything like that. But of course, this backlash that you just described continues to grow and emerge and everything like that. Fast forward to this measles pandemic. And
Measles outbreak.
Excuse me, measles outbreak.
Well, I call it an epidemic.
Measles epidemic outbreak. Yes.
Yeah.
And Eleanor, you have written about this. Just the public response to this has been very different, right? And it's been largely silence.
Yeah, I mean, I think our government officials have been pretty publicly quiet about this. Like, we should say, like, the state has mobilized. They've sent, the Department of State Health Services have sent folks out to West Texas to help. They've launched vaccine clinics. They are doing a lot on the ground. But Governor Abbott has not really addressed this publicly at all. He has tweeted out his statement at a certain point, but saying that the state is responding. But the leaders from that area, elected leaders from West Texas, have not said anything about this. These are people who are very active on social media, right? They're talking about a lot. If what we have heard from certain lawmakers is the opposite, right? I mean, Representative Nate Schatzline from Fort Worth, which has not yet been hit by measles, but he was on Twitter last week bragging about how his children's school district has the lowest MMR vaccine rate in the state, and was really bragging about that and saying, thank you for being patriots, thank you for honoring medical freedom of moms and dads, and not
Yeah, I mean, I don't know where this comes from, but I mean, I know where it comes from. It started 10
wrote the
years
book.
ago, amplified with COVID, and now
Right.
it's spilling back over to childhood immunization. So the Gallup poll did a survey in August last year, August 2024, and you're now seeing the same partisan divide among parents in terms of making vaccine decisions. So the question they ask is, do you think the vaccine is more dangerous for childhood vaccines? The childhood vaccine is more dangerous than the diseases designed to prevent. And there's that clear partisan divide. And you're right. The Texas Health Department's been great. I mean, both the state health department, the county health department, they've been good. All no criticisms at all. They've been setting up vaccination clinics. It's you have no idea how hard it is to combat a measles epidemic because it is so highly contagious. I don't even know how you do contact tracing. So they're doing a terrific job. But how do you now start walking this back? How do you say, and this is my biggest struggle. Okay, you're entitled to your political views. I don't care about your political views, but don't adopt this one because it's so dangerous to you, the health of your family, to you, and this concept of medical freedom, health freedom. It's really pernicious.
And I do think
and you see it now playing out with what RFK Jr. is saying in public.
Right. And I do think, so many people got brought into this medical freedom movement, into all of this. Yes, in part because of the COVID vaccine, but also because of real and perceived vaccine mandates, right? The idea that I'm being required after months of, anger growing about COVID lockdowns, COVID restrictions, all these things. Then it was like, here's another thing you have to do to go back to your job as a healthcare worker or a pilot, and I think that brought a lot of people into this movement that maybe otherwise would not have been, they didn't care before. They would just get their kids the vaccine because vaccines because they were told to. So I do think that was like a pivot moment in a lot of ways that, and it's hard to know, it's hard to say in hindsight, what could have been done differently. But I do think that is what galvanized a lot of people.
Yeah, and I would say, when we talk about Governor Abbott, right? I think, correct me if any of you think I'm wrong here, that there is a slight difference between what Abbott has said. He has maybe been more skeptical of vaccine mandates, but has not been out there saying don't get the vaccine or anything.
No,
like
right.
That. I do wonder, though.
And I've spoken to the governor about vaccines. He was no problem.
Yeah, I mean, he got the COVID shot.
I mean,
right. he did also sue the federal government 4 times over vaccine mandates, right?
Right.
Like, that's the gap, I think.
Right. I do wonder though, like I mean, one of the thing about the COVID vaccine was, of course, COVID we knew disproportionately affected older people. The risk when a younger person, particularly a child, got it, the risk of transmission appeared to be lower. The risk of kind of serious illness was lower when a kid got COVID. Measles seems to sort of be the opposite, right? And it is very dangerous for these young children. Is there any indication that this incident, this case, is inspiring people to rethink their aversion to vaccines, or people getting their children vaccinated when they might have otherwise not, because this is such a particularly scary thing for children?
Yeah, you'd like to, but, and if you look at, a map of COVID vaccination rates in Texas, and you can get this from the New York Times. It looks just like a geopolitical map of Texas. So what does the geopolitical map of Texas looks like? You got these big blue blobs in the shape of a triangle, right? The cities, and then you've got South Texas, mostly in blue, and then there's a sea of red on top of that. And that's what the COVID vaccination rate looks. I mean, it's almost a mirror image of really low vaccination rates in West Texas, the Panhandle, East Texas, the rural counties, everywhere except for South Texas, and the cities. And it's not a coincidence that measles is accelerating now in West Texas. That's, if you were to predict where that was going to happen, this is where it would either be in East Texas or West Texas in the Panhandle. And it began in the Mennonite community, but I think it's now continuing to accelerate. And this is like a hurricane over warm water. I mean, as long as the hurricane's over warm Caribbean water, it'll continue to accelerate. And here, the warm water, the unvaccinated rates, which are substantial now in many parts of West Texas. So I don't. So the only hope for bringing this to an end is to, as the state and local health departments are doing, setting up vaccination clinics, mobile clinics, and encouraging people to get vaccinated. The only thing that stops this is if enough parents agree to vaccinate their kids.
And I think anecdotally, there are stories from West Texas that, I think Lubbock, last time we talked to them, had seen, a couple hundred families come out to get vaccinated. I think a lot of families who maybe weren't as ardently bought into this idea, they just sort of hesitated when their kids were young to get the shot and now are like, hang on, like,
Yeah.
okay, there is a real measles threat out there.
Dr. Hotez, I wonder just like if you could put this thread into context for us. Like, we talked earlier, I have two kids, both of whom are vaccinated, both of whom go to public schools. We're about to go to a busy airport and fly to, and hang out with a bunch of other kids.
And
I mean,
make my Lego
and
NIH
make your
money.
Lego. Yes, exactly.
Right.
I mean, how much do I, using me just as an example for, millions of other families in Texas right now, how much do I need to be concerned about the immediate or even midterm health and safety of my children with this going on right now?
Well, how old are your kids?
So I have a third grader and a sixth grader.
Yeah, so you're fine. I mean, because after the late 1980s, kids got 2 doses of vaccines. So your first dose, which you typically give at 1 year of age, is around 90% protective. Your second dose is gives you up to 97% protection. That's about as good as it can get. And even if there is some breakthrough measles, it'll be greatly mitigated. The the most problematic one right now is if you have an infant child and that infant's not yet old enough to get their first measles dose. So if you have, particularly between 6 and 11 months of age, because prior to that, 4 months, 3 months, the infant will still have maternal antibodies on board because if mom was vaccinated. But then there's that window period of vulnerability between 6 and 11 months where maternal antibody is waning and you don't give the first dose yet. We don't give the first dose earlier because the maternal antibody will interfere with the vaccine. So that's what I worry about now are the parents with infants 6 to 11 months. And then what do you do? Well, if you're in a measles endemic area right now, if you're in West Texas, the state health department has issued an alert to encourage parents and pediatricians to vaccinate earlier, starting between 6 and 11 months, depending on how old they are. and then you wind up getting 3 doses of the vaccine instead of 2 doses of the vaccine. So you vaccinate now, you don't know how well the vaccine takes because there might be still maternal antibodies on board, and then vaccinate again at 12 to 15 months and then 4 to 6 years of age.
So we've talked a lot about the vaccine hesitancy, the politics about this, but there's also just the general public health apparatus. There was a lot of talk, when the COVID vaccine hit about
Or when COVID hit.
sorry, yeah. Well, when COVID and the vaccine
Right,
came,
yeah.
about the underfunding of public health departments, at the state and local and maybe even federal level, about the exhaustion of these folks having to work with this for years. How do you feel like that apparatus, that government system, maybe below the politician level, is holding up, and what are we learning about that system from what's happening with measles in West Texas right now?
Well, I know a lot of people who work in state and local health departments, feel a bit demoralized because they feel like they can't have open discussions like we're having here, and they feel a little bit under siege. There's an added problem that I only learned about recently. So I do a weekly a Zoom call with some amazing colleague. I mean, I'm more of a laboratory science guy in making vaccines and infectious disease in the laboratory, but I do this weekly call with Mike Osterholm, who's an amazing epidemiologist at the University of Minnesota, together with Margaret Hamburg, former FDA commissioner, and Penny Heaton, and Eric Topol, and Ruth Berkelman from CDC, and others. And one of the things that I learned, I didn't realize this, that most state health departments get the lion's share of their budget from the CDC. And I wasn't aware of that. And now that's being cut dramatically in many states. I don't know what's happening in Texas. So that could be another big problem that we may be facing as well. So it's just getting tougher and tougher to implement public health measures. My experience with the state health department, it's outstanding. My experience with, here in Houston, we have 2 public health departments because we have to have 2 of everything, right? We have county and city. So the county and city health departments are top notch. Um, I often wonder why they stay with it, given that the low pay and the stress and everything else, but they're amazing people. So we actually are the heroes in Texas are the public health experts and the journalists and people like you. Or I
We
think
paid him to say that.
I
That's right.
I
Yeah.
I tell I because I come from the Northeast, and I tell people that the smartest, most committed journalists and reporters I've ever met are from the state of Texas, and because you have to be, right,
That's why we
to
have you
survive.
on,
But
Dr.
That's right.
Hotez.
That's right.
Not
no,
for the
it's
measles
Check them out.
heartfelt. I mean,
expertise.
and it goes across. It's not just, and Texas Tribune's wonderful, but it's also true of reporters from every paper I've met. San Antonio, Dallas Morning News, and Houston Chronicle. I mean, Austin State. I mean, an incredible group of people. That's why I'm willing to spend time with you guys, because I was so impressed with what you do.
Appreciate that. I want to ask you just briefly too. I follow you on Twitter. You mentioned kind of being the target of a lot of these vaccine skeptics. From even the days before the COVID pandemic, it seems like due to technological issues, political issues, and maybe cultural issues with our country right now, that abuse it's alarming, right? I mean, I see some of the of what you're subjected to for saying these things publicly. I mean, tell me just about like what this has been like for you as someone who advocates for these things and believes that these things are messages that the public needs to know.
Yeah, I mean, for my adversaries, I'm the trifecta. I'm a scientist, I'm a vaccine scientist, and a Jewish vaccine scientist. So I check all the boxes for attack, and it is gotten to be a very scary place. And part of it is because I've spoken about the anti-vaccine movement in such direct terms. I don't use euphemisms. I I write the same way I'm speaking to you, and I try as hard as I can to thread the needle to say, look, uh, don't think of me as a political figure. I don't care about politics. I you know I That's not what I'm interested in. I just want you to uncouple the stuff that's going to put your family in harm's way. And no matter how much I swear up and down about that, I still get attacked. And it's interesting. One of the major ways they attack me is they claim I'm, in bed with the big pharma companies, and I'm taking millions of dollars from pharma companies, and which my wife Ann says, if only. But and the answer is I don't. That's the opposite. I've devoted my life to being a pediatrician scientist that makes low-cost vaccines for the world, proving we could bypass the big pharma companies. And we did it. And I did it because I'm in Texas, and the resources of being part of this amazing Texas Medical Center at Baylor College of Medicine, Texas Children's Hospital. Our COVID vaccine proved we could bypass big pharma companies. We made low-cost recombinant protein COVID vaccine that reached 100 million people in India and Indonesia, bypassing pharma. But the assertion still is out there on Elon Musk X that I'm a shill for the pharma companies, no matter how much you swear up and down. And then it takes on other dark turns. It claims I'm secretly making the COVID virus. And Alex Jones goes after me, says I'm part of what do they call it? Plandemic. They don't call it pandemic, they call it plandemic, that it's all designed to disrupt society. And of course, I'm doing this because I'm Jewish. I'm doing it with George Soros and one of the Rothschilds, and they've got me and apparently the laboratories at Davos at the World Economic Forum. But I tell them, look, the labs are better in Texas, and but and the crazier the conspiracy, the more pile on there is. And that's something very dark also. That's something I never thought I'd see as a I went into this because I thought it was the most noble thing you can do is science in the pursuit of humanitarian goals, making low-cost vaccines for the world. It never occurred to me I'd be treated as a public enemy or a cartoon villain, and that's very tough.
Yeah, I'm involved in my new position as editor in chief in the planning for the Texas Tribune Festival, and we were just having a conversation. I realized about a week ago we were talking about security issues, and one time you, Doctor, spoke at the Tribune Festival, and there was a report of someone kind of outside the panel looking to kind of stir up controversy and anger about it. And that man is now our Secretary of Health and Human Services, RFK Jr. He had appeared kind of uninvited at the festival, and so
Yeah,
I mean,
that was like one of those dreams you have when you drink too much red wine the night before, at dinner. And it's just
Right.
right.
And now,
and I had this dream that Robert F. Kennedy Jr. came to my
yeah.
panel discussion, and the doctor told you not to drink so much red wine before you go to
Yeah,
dinner.
right.
But
Yeah.
but there it was. It actually happened.
Indeed.
Yeah, that's really strange. By the way, we have a new book coming out in the fall, in September. And I hope maybe you'll invite me back. I'm doing this with Michael Mann, the climate scientist, who gets beat up like I get beat up on the climate science side. And we're comparing notes. And the book is called Science Under Siege. And we look at the overlap between the attacks on climate science and biomedical science. And there's a surprising amount of commonality, which is quite interesting.
We will prepare our invitation. That
Yeah,
sounds like
save
a
the
great
date,
book and a
November
conversation. 13th through
13th to
15th.
15th.
Yes.
Yeah.
Eleanor, speaking of upcoming works, we'll be running kind of a series of stories on the 5th anniversary. Those will be launching hopefully the day this is appearing in your podcast feeds on Tuesday. Tell us just quickly what to look for in that coverage.
Yeah, I mean, we realized so much has changed in Texas in the last 5 years, and we thought this was a good opportunity to look back, not just on what happened during COVID, but lessons we've learned, and the whole health team has contributed to this. So our first story is coming out today, and looks at how prepared Texas is for the next pandemic. Spoiler alert. Not as prepared as we might hope in certain ways. And we are also going to, in the future, have stories looking at the death count, really what the human toll of this all was, looking at ARPA funding, where that all went. And yeah, just an opportunity, and really, what the impact has been on Texas politics. So an opportunity to sort of take stock of 5 crazy years.
Absolutely. Okay.
I mean, the story that I would really want to see get out more is the story of this extraordinary Texas Medical Center where I work at Baylor College of Medicine, Texas Children's Hospital. you know, when I was going on the cable news channels, going on CNN and MSNBC, I was even going on Fox News for a while until I didn't go get a, I wouldn't go along with the hydroxychloroquine nonsense, and then the invitation stopped there. But one of the frustrations that I always had going on the cable news channels is, the way in the Northeast they want to portray us here in Texas, and all they want to do is talk about the wackadoodle. And I would try to explain, no, wait a minute, I came to Texas to up my game for science and medicine. I mean, I can do things in our Texas Medical Center in terms of life-saving interventions that I couldn't do anywhere else. It's been the most productive time of my scientific career, but that story doesn't get out enough, and that's and I don't know how we do that. But we tend to be very inward looking in terms of our public outreach, but there's something also very special going on here. I mean, I didn't really come because of the climate. I mean, well, I did, I guess, because I work on tropical diseases, but
Sure.
um, the in terms of solving big problems in the world, you can do more in Texas, I think, than anywhere else, and that's why I stay. That's why I'm here.
Interesting. Thank you for that. Thank you for joining us on the show. Thank you, Eleanor. Looking forward to reading those stories as well. And a big thank you to Rob and Chris, our producers. That is it for the podcast. We will be back next week.